What if I told you that the biggest threat to your heart isn't your diet, your stress levels, or even your family history? What if the real danger is sitting quietly in your medicine cabinet right now, disguised as something you trust completely? As we get older, protecting our hearts becomes more important than ever. But here's what most people don't realize. The medications you take every single day, the ones your doctor prescribed, the ones that are FDA approved and used by millions, might be the very thing quietly damaging your heart, especially if you're over 60. We're talking about pills you've taken for years without question, pills that get refilled automatically, pills whose side effects are so subtle, you've probably dismissed them as just part of getting older. But what if they're not? I'm Dr. Emma Caldwell, and I've spent over a decade helping seniors just like you protect their heart health and maintain their independence. In my years of practice, I've seen hundreds of patients walk into my office with weakened hearts, not from disease or genetics, but from the very medications they trusted to keep them healthy. Today, I'm breaking down 5 common pills that could be quietly damaging your heart. More importantly, I'm going to tell you exactly what you can do about it, because knowledge is protection, and you deserve to understand what's really happening inside your body. Now, before we dive in, I want to be very clear about something. These aren't rare or experimental drugs. Every single medication we're going to discuss today is FDA approved, doctor prescribed, and sitting in millions of medicine cabinets across America. Some of them you probably recognize. Others might surprise you, but all of them deserve a second look, especially after the age of 60. The problem is how our healthcare system works. Prescriptions get renewed automatically, often without anyone asking whether they're still necessary or whether the dose is still
whether they're
appropriate.
still
Side
necessary
effects
or
creep in
whether the
so
dose is
slowly
still
that they're mistaken for
appropriate.
the natural
Side
aging
effects creep in
process,
so
and
slowly that
dangerous
they're mistaken for the
combinations.
natural
They're too
aging
often
process
overlooked
and dangerous
entirely. One
combinations.
pill leads to
They're
another, and
too
before you
often
know it,
overlooked
your body
entirely.
is juggling
One pill
5,
leads to
6,
another,
7 different
and before you know
medications
it,
that were
your
never
body is
tested
juggling
together,
5,
especially
6,
not
7
in
different
aging systems.
medications that
But
were
that
never
changes
tested
today.
together,
So let's
especially
begin with
not in
number 5, ibuprofen and NSAIDs, the hidden strain on aging hearts. Ibuprofen, naproxen, diclofenac. These painkillers are everywhere, trusted, familiar, easy to find. When pain flares from arthritis, a stiff back, or headaches, most people reach for one without thinking. They're over the counter, so they seem harmless. But after 60, these pills can quietly become serious heart risks. Let me tell you about Margaret, a 71-year-old retired teacher who loved gardening. For years, she managed knee arthritis with ibuprofen, not daily at first, just when needed. Gradually, it became routine. One tablet with breakfast, another after lunch. Then one afternoon, while watering roses, she couldn't catch her breath. Her ankles had swollen so much her shoes didn't fit. The emergency room revealed acute heart failure. Her heart, already working overtime from age and mild hypertension, couldn't keep up. The trigger? That innocent anti-inflammatory pill she'd taken daily for years. How can something so common be so dangerous? NSAIDs affect how your kidneys manage salt and water. In younger adults, bodies adjust. But kidney function naturally declines with age, even when labs look normal. Your body retains extra fluid, swollen ankles, tighter shoes, heavy legs, exhaustion. Easy to dismiss as aging, but they're warning signs. This fluid retention dramatically increases heart workload. Picture your heart as a pump moving water through pipes. Suddenly, there's 30% more fluid. The pump works much harder. For those with high blood pressure or heart disease history, that pressure can worsen heart failure or spike blood pressure dangerously. NSAIDs also reduce kidney blood flow, weakening function over time. They're linked to elevated blood pressure, kidney damage, increased heart attack, and stroke risk. Even short-term use becomes risky when combined with diuretics or ACE inhibitors, the triple whammy that severely impairs kidney function and increases heart strain. If you take low-dose aspirin for heart protection, certain NSAIDs like ibuprofen can cancel that protection entirely. The insidious part? You won't feel your kidneys struggling or your heart working harder. Symptoms are quiet: swelling, fatigue, dizziness. Because they're over the counter, they don't seem serious. That's what makes them risky. If you're taking NSAIDs regularly over 60, talk to your doctor. You may not need to stop completely, but occasional use instead of daily makes a huge difference. Safer options include acetaminophen for certain pain, topical creams that work locally without affecting heart or kidneys, or lifestyle approaches like stretching, heat therapy, or physical therapy. The goal isn't suffering in silence, it's treating pain without creating bigger problems. For older adults, NSAIDs seem harmless, but may quietly put your heart at serious risk. Now let's move to number 4, benzodiazepines, the sleep aid that steals your stability. If you've struggled with sleep or racing thoughts, your doctor may have prescribed lorazepam, diazepam, or temazepam. These benzodiazepines feel like a lifeline, helping you sleep, calming anxiety, restoring normalcy, but they may quietly increase your risk of falls, confusion, and long-term cognitive decline. Robert was 74 when insomnia became unbearable. His doctor prescribed a benzodiazepine, and he finally slept soundly. Such relief. But months later, his wife noticed changes. Robert seemed foggy, forgetting recent conversations. His balance was off, steadying himself on furniture. Then one night, groggy and disoriented, he fell and fractured his wrist. At the hospital, his doctor asked how long he'd been taking it. 8 months. She shook her head. These were only supposed to be for a few weeks. Benzodiazepines slow brain and nervous system activity, why they help you feel calm and sleepy. But in older adults, this goes too far. They don't just relax your brain, they slow reaction time, impair muscle control, and affect balance. This dramatically increases fall risk, especially at night. Falls are leading causes of injury, hospitalization, and independence loss in seniors. The danger goes deeper. Benzodiazepines link to memory issues, mental fog, and higher dementia risk with long-term use. What starts as mild forgetfulness progresses, and people never trace it to medication. They assume it's normal aging. Then there's dependence. Your body adjusts over time. You need more for the same effect. Stopping suddenly triggers dangerous withdrawal, severe anxiety, insomnia, restlessness, tremors. A vicious cycle. You need the pill to sleep, but it's damaging the clarity sleep should restore. What should you do? Don't panic and never stop. Suddenly, that's life-threatening. Talk to your doctor about a slow, supervised taper or safer alternatives. Non-drug therapies work remarkably well. Cognitive behavioral therapy for insomnia, CBTI, is highly effective without side effects. For anxiety, try mindfulness, breathing exercises, gentle exercise like walking or Tai Chi, or certain newer antidepressants without the same balance or memory risks. Not every sleep problem needs a sedative. For older adults, what seems like small relief can come at a very high cost. That little pill helping you drift off might be quietly pulling away your balance, awareness, and independence. Now, let's move on to number 3. Proton Pump Inhibitors, the silent drain on your heart and body. Heartburn, acid reflux, that burning sensation in your chest. They're incredibly common as we age, and for many people, the solution comes in the form of a little pill, omeprazole, pantoprazole, esomeprazole. You might know them as Prilosec or Nexium. They're called Proton Pump Inhibitors, or PPIs, and they work by dramatically reducing stomach acid. For short-term relief, they can feel like an absolute miracle. No more burning chest, no more sour taste in your mouth, no more pain after meals, just one pill a day, and the discomfort disappears. But here's the part most people never hear. These pills were never meant to be used long-term, especially not in older adults. Millions of seniors take PPIs every single day for months, sometimes years, without ever reevaluating whether they still need them. And over time, that quiet routine can come with serious consequences, some of which directly affect your heart, your bones, and your overall strength. Let me tell you about Helen. She was 68 when her doctor prescribed omeprazole for chronic reflux. "Take this every morning," he told her. "It'll protect your stomach." Helen did exactly as instructed. Her reflux disappeared, and she never questioned it again. Years went by. Then, during a routine checkup, her electrocardiogram showed something unusual. Her heart rhythm looked irregular. Blood work revealed the cause. Her magnesium levels had dropped dangerously low. Magnesium is absolutely crucial for your heart's electrical system. When it's depleted, your heart becomes unstable, like an orchestra without a conductor. Dangerous arrhythmias can emerge, the kind that can lead to fainting, stroke, or even sudden cardiac arrest. The cause of Helen's deficiency? Years of taking omeprazole every single day. Here's why this happens. PPIs, reduce stomach acid. But that acid isn't just there to cause you discomfort. It plays a critical role in helping your body absorb essential nutrients like calcium, magnesium, iron, and vitamin B12. When acid levels drop too low for too long, those nutrients simply don't get absorbed the way they should. Low calcium means weaker bones. In older adults, that translates to a significantly higher risk of fractures, especially hip fractures, which can be absolutely life-altering. And it doesn't stop at bones. Magnesium deficiency, which is alarmingly common in long-term PPI users, can affect your heart rhythm, cause painful muscle cramps, and lead to dizziness and fatigue. Low iron and vitamin B12 can cause anemia, nerve damage, or mental fog. All issues that look like natural aging but may actually be medication-related. And then there's your immune system. Stomach acid plays an important role in protecting you from harmful bacteria. When it's suppressed for too long, your body becomes more vulnerable, especially to infections like Clostridioides difficile or C. diff, a gut infection that can cause severe diarrhea, dehydration, and, in serious cases, hospitalization, particularly dangerous in older adults. Some studies have even linked long-term PPI use to higher risks of kidney disease, dementia, and cardiovascular problems. The research is still evolving in those areas, but the pattern is becoming increasingly clear. The longer you take these medications without reviewing your actual need for them, the more the risks begin to outweigh the benefits. Now, that doesn't mean PPIs are inherently bad. They're effective, and in many cases, they're absolutely necessary, especially during active ulcers, severe esophagitis, or certain stomach conditions like Zollinger-Ellison syndrome. But what should be a temporary treatment, 4 to 8 weeks, often turns into a permanent habit. Prescriptions get renewed automatically. Nobody questions it, and the consequences accumulate silently. If you've been taking a PPI for more than a few months, it's absolutely worth talking to your doctor. You may still need it, or you may not. Some people can switch to lower doses, take the medication only when symptoms flare up, or taper off entirely under careful medical supervision. Lifestyle changes, like eating smaller meals, avoiding trigger foods, elevating the head of your bed, and losing weight if needed, can also make a tremendous difference. Because sometimes, relief today shouldn't come at the cost of your strength, your balance, and your resilience tomorrow. Now, let's move to number 2, heart and blood pressure medications, when the cure becomes the risk. When we think about medications that damage the heart, blood pressure pills usually don't come to mind. In fact, they're supposed to protect it, to lower the pressure, reduce the strain, and help your heart do its job more efficiently. And for millions of older adults, these medications are absolutely essential, life-saving even. But here's the uncomfortable truth. The same medications prescribed to protect your heart can also put it at risk, especially if the dose is too strong, the combination is too complex, or your body has changed significantly since the prescription was first written. Let me tell you about Frank. He was 76, a retired engineer who'd always been meticulous about his health. Over the years, his doctor had prescribed several medications: a beta blocker to slow his heart rate, a diuretic to manage fluid, a calcium channel blocker to relax his blood vessels, and a cholesterol medication for good measure. On paper, everything made sense, but Frank started feeling off. He was tired all the time. He felt dizzy when he stood up. His mind felt foggy, like he was thinking through a cloud. He assumed it was just part of getting older. Then one afternoon, Frank collapsed while getting the mail. His neighbor called an ambulance. At the emergency room, we discovered his blood pressure had dropped dangerously low. His potassium levels were out of balance, and his heart rate was slower than it should be. The problem wasn't his heart condition. The problem was that his medications, all of them working at once, had overwhelmed his system. He was suffering from what we call medication overload, and it's shockingly common. Let's break down what can go wrong with each type of heart medication. Diuretics, often called water pills, help your body release excess fluid and salt. They're commonly used to treat high blood pressure and heart failure, but in older adults they can lead to dehydration, dangerously low potassium levels, sodium imbalances, and dizziness. That tired, lightheaded feeling when you stand up? It may not be aging. It might be your water pill pulling too much from your system, leaving you depleted and unsteady. Then there are calcium channel blockers, which relax the blood vessels to reduce pressure. But in some seniors, they cause noticeable swelling in the legs and ankles, slow the heart rate too much, or lead to persistent fatigue and brain fog. You might feel like you're moving through molasses all day, and nobody connects it back to your medication. Beta blockers, another extremely common class of heart medication, can be just as tricky. They slow your heart rate, which is often helpful, but sometimes they slow it down too much. This can cause shortness of breath, cold hands and feet, and reduced exercise tolerance. You might find yourself unable to do things you used to do easily, like climbing stairs or walking around the block. And for people with diabetes, beta blockers can even mask the warning signs of low blood sugar, creating a hidden and potentially dangerous situation. The truth is, your body changes dramatically with age. Blood vessels stiffen, kidneys filter more. Slowly, the way your body handles salt, water, and blood pressure shifts significantly. A dose that worked perfectly well when you were 55 may now be far too much at 75. But here's the problem. Nobody reevaluated. The prescription gets refilled, the routine continues, and the body quietly struggles. And it's not just about one pill. Many older adults are prescribed multiple heart medications simultaneously. A beta blocker, a diuretic, something for heart rhythm, something for cholesterol. The combination can quietly overwhelm your system. This is called polypharmacy, and we're about to talk about it in depth because it's our number one danger. But for now, understand this. These medications can absolutely be life-saving. They've prevented countless heart attacks and strokes, but they need to be reevaluated regularly, not just renewed out of habit. The goal isn't simply to control numbers on a chart. The real goal is to help you stay sharp, steady, mobile, and independent. If you or someone you love is over 60 and taking multiple medications for blood pressure or heart disease, it's time to ask, are these doses still right? Are they working together, or are they working against each other? Because the right heart medication can save your life, but the wrong combination can quietly steal it, piece by piece. Now it's time for number one. And this is the most important one of all. Not because of what it is, but because of how common it's become. We're talking about the most dangerous pill, and it's polypharmacy. The most dangerous pill is all of them. If there's one thing that poses the greatest risk to older adults, it's not a single pill, it's the combination. Polypharmacy, the term for taking 5 or more medications at once, has become one of the most dangerous and overlooked threats to senior health. And it's shockingly common. Studies show that nearly half of all adults over 65 take 5 or more medications every single day. Many take far more. A pill for blood pressure, another for cholesterol, something for sleep, something for pain, an acid reducer, a multivitamin, a mood stabilizer. One pill leads to another and another until your body is juggling a complex cocktail of drugs that were never tested together, especially not in aging systems. And here's what most people never hear. Every new medication increases your chance of side effects. Every combination raises the risk of harmful interactions. Every extra pill makes it harder for your kidneys, your liver, and your heart to keep up. The effects aren't always dramatic. They're subtle. You feel more tired. You're less steady on your feet. You start forgetting things. Your digestion slows down. Your mood shifts. Most people assume it's just part of aging, but sometimes it's not. Sometimes it's the pills. Let me tell you about Dorothy. When I first met her, she was 72 and struggling. Over the course of 5 years, she'd accumulated 9 different daily medications. It started with blood pressure medication. Then a diuretic was added to help with fluid retention, a sleeping pill because she couldn't rest, a stomach protector because the pain medication upset her digestion, an antidepressant because she felt down. Each one made sense at the time. Each one was addressing a specific problem, but nobody ever stepped back and looked at the full picture. Dorothy's family brought her to see me because they were worried. She'd become forgetful, confused at times. She'd fallen twice in the past month. They thought it might be dementia. But when I reviewed her medication list, I saw something different. I saw a woman whose body was drowning in prescriptions. Working with her primary care doctor, we carefully reviewed every single medication. We eliminated 5 that were either unnecessary or treating side effects from other drugs. Within 3 weeks, Dorothy was a different person. Her mind cleared, her energy returned. She stopped falling. It wasn't dementia, it wasn't aging, it was medication overload. And the most troubling part? Many of those prescriptions were no longer needed. They'd been given months or even years ago for conditions that had changed or resolved, but they were never stopped. Sometimes the original condition improved. Sometimes the side effect of one drug was being treated with another, creating a cascade. It's a quiet spiral, not into better health, but into fatigue, frailty, and dependence. Polypharmacy doesn't just put strain on your heart. It can steal your clarity, your energy, your independence. It increases your risk of hospitalization, not because of the conditions being treated, but because of how those treatments interact. Your kidneys can't filter everything efficiently. Your liver gets overwhelmed. Drug levels build up in your bloodstream, and suddenly you're dealing with symptoms that nobody can quite explain because nobody's considering that it might be the sheer number of pills you're taking every day. The solution isn't to stop everything. That would be dangerous. The solution is to review everything. A skilled doctor or pharmacist can help you go through your list, medication by medication, and ask the critical questions. Is this still necessary? Is the original condition still present? Could the dose be reduced? Are there safer alternatives? Are we treating a side effect that could be eliminated by stopping something else? And the results of a thorough medication review can be absolutely life-changing. Less dizziness, more energy, better focus, a clearer mind, fewer falls, fewer hospital visits, and sometimes just feeling like yourself again, maybe for the first time in years. Now, if you found this video valuable, share this video. A simple click sharing this video could start a conversation that genuinely saves their life. I am Dr. Emma Caldwell, and I will see you in the next video.